okay, so this is the first case. This is a T2 weighted image, and you can see that there's this lobulated T2 hyperintense lesion arising from the seminal vesicle on the left, kind of just above the prostate gland. Pretty T2 bright. Sorry. And you can see this is the arterial phase, and this lesion is very avidly enhancing. So it was pretty T2 bright. It's very avidly enhancing. It didn't seem to have flow voids within it. Do you guys have any thoughts? It's not a common lesion. And adenocarcinoma, even though they tend to arterial enhance and wash out, they usually aren't this lobulated T2 hyperintense bright. Somebody chatted something in.
Cookie wants it. I want to see it.
Okay. Oh, that's awesome. Okay. So Patty said possibly hemangioma, which is a great idea. So Cookie, this is, it's arising from the seminal vesicle. It's very avidly enhancing here. And then I'll show you what the T2 looked like.
T2 dark?
It's T2 bright like this.
It looks like it's, I mean, there are, you know, angiomyxomas. There's some, it's not a sarcoma, but it's the other.
Yeah, there's sometimes there's stump tumors of the prostate. We've shown those sometimes in case conference. Stromal tumors of uncertain malignant potential, but that usually is of the prostate, not as avidly enhancing.
It looks like a BPH.
It's so exciting. Cookie's here.
Yeah, I mean, I'm thinking of that. It's like a phylloides, but it's in the male seminal vesicle. It's a similar.
Okay, any other thoughts? Anyone else? Last chance.
Can you show the diffusion?
No, it restricted diffusion.
I think the hemangioma was a pretty good thought. You know, vascular malformation, not so much because there's no flow voids there.
Yep. So yeah, this turned out to be a prostatic paraganglioma. So I have a couple of points, teaching points about this. So this is my case, the paraganglioma. 90% of paragangliomas are in the adrenal gland, 10% are extraadrenal. Of those 88%, the majority will be in the para-aortic space. Also, bladder pheos are not uncommon. For prostate, it's pretty rare. There's 11 case reports, but I'm pretty sure it's more than that. Symptoms are hematuria, hypertension after micturition, or defecation, depending on how large they are. Some of the case reports showed like 10 centimeter tumors. 10% of paragangliomas will be malignant. You can't really tell if one is malignant until you follow it up and see if it metastasizes. So just based on pathology, you can't tell. And about 50% of these are hereditary. And this patient also had a carotid body paraganglioma. So they have familial paraganglioma syndrome with an SDHD mutation. Any comments? Somebody chatted.
Cookie said that's a nice case.
And Claire says there's 15 cases of gallbladder paragangliomas as well. So I guess the teaching point is if you see something really avidly enhancing, pretty T2 bright, I think hemangioma is a great idea, and as well as paraganglioma. But would be atypical for a typical adenocarcinoma, so you might want to biopsy it. And you also, if you bring up the paraganglioma, they can check for urine metanephrines.
I mean, those are usually resected in the OR. I mean, those are, you can't really biopsy.
Can you hear her?
Them.
Yeah, this was resected. I do have a companion case. So this is a female. So this is a bladder, that's the bladder. And then this is the urethra. So normally the urethra should have this trilaminar appearance where you see like a targetoid appearance, but this one is pretty T2 bright and expanded by a mass. And
Nice case.
This is what it looked like on the arterial phase. So to me, it looked very similar to the prostatic case. And this is what it looks like on sagittal. here. So whoever, people who are chatting in too, you can, you're welcome to also speak. So anyway, this one that was biopsied, it was a urethral tumor,
So
and it was
that one not-
biopsied. Any thoughts?
So I'm not sure if it's just the projection, but it's not quite as bright on the T2.
Yeah.
Right. So, I mean, sort of intraurethral tumors, besides malignancy, you also want to think about sort of leiomyomas you can get in the urethra.
That's a great thought. So you can get urethral leiomyomas. Those tend to be a little bit T2 darker.
Yeah.
It was pretty avidly enhancing, which
Yeah.
leiomyomas can do, or what this was. So Cookie, I'll show you the
Cookie says
sagittal.
melanoma.
What'd you say?
Cookie asked me, told me to say melanoma in the DDX, but she didn't say
Oh.
sagittal.
That's a great thought.
What's that thing in the
Okay,
bladder?
here's the map. Huh?
Is there a lesion in the bladder?
I
Or is it
think
just a
that might be
dermatoma?
like a urachal cyst. Like, I don't, there was a cyst at the top of the bladder as well. Anyway, this was biopsied and it came back hemangioma. So T2 bright, avidly enhancing, think about hemangiomas and perigangliomas. I happen to have been searching for a case of a hemangioma recently because I wrote a urethral review article, which I don't recommend. I mean, people tell you not to write those things. And anyway, I did feel like that was one of the advantages of writing a review article, was that I knew that there was this entity that I couldn't find a case of at Emory until now. So anyway, just know that you can get hemangiomas anywhere. And one teaching point about that, so this was my case, but one teaching point is that it's more common in males. And so if you see like T2 bright lesions that kind of resemble hemangiomas elsewhere along the male urethra, think about a hemangioma.